Our next speaker is Joanna Karasinska from BC, Canada, and she's going to be telling us about genome and transcriptome signatures of cachexia and metastatic pancreatic ductal adenocarcinoma.
Okay, so our team investigates clinically relevant molecular subtypes of pancreatic ductal adenocarcinoma, or PDAC, and we lead the PenGen trial, which focuses on understanding molecular heterogeneity of metastatic PDAC. And in PenGen, patients' tumor biopsies, and these are mostly liver biopsies, undergo whole genome and transcriptome sequencing at baseline prior to standard treatment with gemcitabine, nab-paclitaxel, or FOLFIRINOX, and clinical monitoring. Analysis of weight changes during each follow-up visit demonstrates that 75% of patients experience cachexia defined as greater than 5% weight loss 6 months from baseline. And these patients' treatment journey, as well as survival, is shorter than those without cachexia. Previously, we have subtyped PDACs based on the expression of genes involved in glycolysis and cholesterol synthesis, and we found that tumors that had higher level of glycolytic genes but lower levels of cholesterogenic genes were associated with the worst prognosis. So we asked if cachexia is associated with PDAC subtypes. So we analyzed 50 genomes, and we found that although we don't find statistically significant differences across all mutated genes between the cachexia and non-cachexia groups, tumors from patients with cachexia tend to have higher levels of homozygous loss of CDKN2A, which is an oncogenic driver event in PDAC. We do find, though, that cachexia tumors have a higher subclonal tumor mutational burden, which can contribute to the chemo resistance in these patients. When we looked at the metabolic subtypes, we found that 95% of glycolytic tumors were from patients with cachexia, compared to 50% of cholesterogenic tumors. And this aligned with the difference in survival, where the median overall survival is about 17 months in the cholesterogenic tumors and only 10 months in the glycolytic tumors. We performed differential gene expression analysis to look at some of these genes that are expressed differently, and we found some genes that are expressed at higher levels in the cachexia group that may be involved in tumor aggressiveness and metabolism. One of the genes that we are following up on right now is IRX3, which is a transcription factor. It is regulated by the obesity risk gene FTO, and IRX3 has a cell autonomous and non-autonomous function in energy balance and organ development. And there's some indication that it may also be involved in mitochondrial respirations. So we took 8 PenGen patient-derived organoids, and we tested them in the seahorse glycolytic stress test and the mitochondrial stress test, and found that organoids from tumors with higher IRX3 expression have higher glycolytic reserve as well as higher ATP-linked respiration, suggesting that there might be higher oxidative phosphorylation, but also better adaptation to metabolic demands such as hypoxia. And it is important to note that most of the patients already experienced weight loss at the time of diagnosis when we compare it to their weight 1 year prior to diagnosis. And we found that this extent of this weight loss is diagnostic. So using a specific test, we find a threshold of greater than 7% of pre-diagnostic weight loss associated with worse survival. And we're excited to continue to look at the molecular and the clinical parameters of cachexia in other studies that we're doing. One of them is Accelerate, which is a study similar to PenGen, except in resectable and locally advanced PDAC. We're also looking at longitudinal analysis of sarcopenia and adipose mass in PenGen. And we have a few other trials to look for. It's the immunotherapy trial in metastatic PDAC, and we're also starting a small glycemic control study in metastatic PDAC called Pegasus. So we are a multidisciplinary group forming Pancreas Center at BC Cancer in Vancouver. It is directed by Dan Renaud and David Schaefer, and James, Steve, and Hassan contributed data to the presentation today. Thank you.